There's a moment every morning when your blood pressure medication can turn against you. Not because the pill's wrong, not because your doctor made a mistake, it's about what your body is doing in the 60 seconds after you take it. And if you're swallowing that pill and then standing straight up, you may be setting yourself up for a fall, a dizzy spell, or worse. By the end of this video, you'll know exactly when that danger window opens, why it happens even to people whose blood pressure is perfectly controlled, and the simple change that closes it for good. Why this happens. Here's what's really going on. When you sleep, your blood pressure naturally dips. That's healthy. It's called nocturnal dipping, and your heart gets a break. But the moment you wake up and swing your legs out of bed, your body has to do something remarkable in a matter of seconds. Blood that pooled in your legs and abdomen overnight has to get pumped back up to your brain, and your blood vessels have to constrict quickly to keep your pressure stable as you go from lying down to standing. This is called the baroreflex response, and it tends to slow down with age. Layer a blood pressure medication on top of that, something specifically designed to relax your blood vessels or reduce the force of your heartbeat, and you've got two systems working against each other at exactly the moment you're the most unsteady on your feet. That combination has a name: orthostatic hypotension, and it's one of the most under-recognized causes of falls in adults over 60. Let's talk about why mornings specifically. Your blood pressure doesn't rise gradually after you wake up, it surges. Within the first hour of waking up, most people experience a sharp increase in blood pressure as part of the body's normal shift into daytime activity. This is actually why heart attacks and strokes cluster disproportionately in the early morning hours. Now, picture taking a medication that's near peak strength, riding alongside a body that's already adjusting to a natural pressure surge and a sudden postural change. For most people, this balances out fine. But for the millions of older adults managing hypertension, this is where dizziness on standing, that head rush when you get out of bed, or even a fall on the way to the bathroom tends to happen. You might be wondering whether the fix is simply switching to evening dosing. It's a reasonable question, and for years, some research suggested nighttime dosing dramatically lowered cardiovascular risk. But the more recent and much larger trials, including one that followed over 21,000 patients for more than 5 years, found that morning and evening dosing produced essentially the same protection against heart attack, stroke, and cardiovascular death. So this isn't really a morning versus evening problem. It's a standing up too fast problem. And it can happen at any hour if you take your pill and immediately jump into motion. The second danger window worth knowing about involves a specific type of blood pressure medication: diuretics, sometimes called water pills. These work by helping your kidneys clear excess fluid, which means more trips to the bathroom. If you take a diuretic at night, you're likely to be woken by the urge to urinate in the dark, groggy, possibly still feeling the blood pressure lowering effect of the medication, which is exactly the combination that leads to nighttime falls. This is why diuretics are generally recommended for morning use, not evening, regardless of what you decide for your other blood pressure medications. So let's get practical. Here's how you protect yourself starting today. First, build in a pause after you take your medication, especially first thing in the morning. Instead of standing straight up from bed, sit on the edge of the mattress for a full 60 seconds. Let your body catch up. Then stand and pause again for a few seconds before you start walking. This sounds almost too simple to matter, but this two-step transition, sit, then stand, then wait, is one of the most effective ways to give your baroreflex response time to catch up with your medication. Second, pay attention to your own early warning signs. Lightheadedness, a brief graying of your vision, or feeling unsteady when you stand are not things to push through. They're your body telling you that your blood pressure has dropped faster than your vessels can compensate. If this happens regularly, that's information your doctor needs, not something to just work around on your own. Third, know which of your medications is a diuretic and take it in the morning, not at night, unless your doctor has specifically told you otherwise. If you're not sure which of your pills falls into that category, that's a completely reasonable question to bring to your next pharmacy visit or checkup. Fourth, if you take multiple blood pressure medications, be extra cautious around the time you take the second or third one of the day. Stacking medications means stacking their blood pressure lowering effects, and that's when the standing up danger window tends to be widest. And fifth, keep a glass of water and something to hold on to near your bed. If you do feel that head rush, Having a chair, a nightstand, or a wall within reach in those first few seconds can be the difference between catching yourself and a fall that lands you in the emergency room. None of this means your medication is dangerous, or that you should skip a dose or change your routine without talking to your doctor first. Blood pressure medication is doing exactly what it's supposed to do, protecting your heart, your kidneys, your brain from the long-term damage of hypertension. The danger isn't the pill, it's the 60 seconds of transition your body needs and doesn't always get. Respect that window, and you get all of the protection with almost none of the risk. If this changed the way you think about your morning routine, share it with someone who takes blood pressure medication, a parent, a spouse, a friend you check in on. It's the kind of thing that's easy to pass along and could genuinely prevent a fall. And I'd love to know, did you already know about this standing up danger window, or is this the first time you're hearing it? Drop it in the comments, and I'll see you in the next one.